For my topic, I decided to do esophageal cancer. Esophageal cancer is an uncontrolled division of abnormal cells in the esophagus. The esophagus is a hollow muscular tube connecting the mouth to the stomach. There are two types of esophageal cancer, squamous cell carcinoma and adenocarcinoma. There are 16,980 new cases, and of that number, 15,590 die. Men are 3 to 4 times more likely than women to get esophageal cancer. These are the two types of esophageal cancer and comparing to each other. Adenocarcinoma is the more common of the two, is usually in the lower portion of the esophagus and is in the mucus secreting glands. Squamous cell carcinoma is usually in the middle of the esophagus and is in the squamous cells, the thin, flat layers of the esophagus. Some symptoms of esophageal cancer are trouble swallowing, chest pain, weight loss, and vomiting. Trouble swallowing is the number one symptom for esophageal cancer. This is usually the first sign when people start to notice something's wrong with their body and they go for a checkup. They literally cannot swallow food because the tumor is blocking the esophagus. These are some of the different treatment options for esophageal cancer. There's chemotherapy, radiation, and surgery. And in the surgery, they cut your esophagus, which has the tumor in it, and they pull up your stomach and connect it to the remaining portion of the esophagus. This is a really risky surgery. It can take a long time, up to 9 hours, and there's a lot of risk of infection after the surgery. And all of the treatment just depends on where stage you're at in your cancer and what your doctor decides for you for your medical history and other reasons. The doctors stage people in every type of cancer, not just esophageal cancer. Based on how advanced you are, they give you a number: stage 0, stage 1, stage 2, stage 3, and stage 4. In stage 1, it is a small tumor that has not grown deeply into nearby tissues and not spread to the lymph nodes or other parts of the body. Stages 2 and 3, the tumor is larger in size, it's grown more deeply into nearby tissue and into the lymph nodes, but not into other parts of the body. Stage 4, cancer has spread to other organs. It's also called advanced cancer. And in the chart below, this is survival rates for esophageal cancer. You can see on the left as the stages increase to more advanced cancer and you move over to the amount of years that they survive, the numbers decrease. And usually with your first signs of esophageal cancer, trouble swallowing, it's usually in the later stages that you find it out because the tumor has grown so much, it's advanced in the stage by then. Some risk factors for esophageal cancer are tobacco use, alcohol use, if you're between the ages 45 and 70, if you're male, your race, Barrett's esophagus, like if you've had previous problems with your esophagus, like reflux, and obesity. And just because you fit into these risk factors, it doesn't mean you're automatically going to get esophageal cancer. And just because you don't fit into any of these, it doesn't mean you're safe from esophageal cancer either. This is the reference page that I used for my project. It has a lot of great information on it if you're more curious about the disease.